And now on the line is Breda Gahan from Concern Worldwide. Breda, welcome back to Near FM.
Thanks, Darren. Thanks for your interest and to your Near FM listeners, and for your continued support of Concern's overseas work on extreme poverty reduction with our implementing partners. Delighted to talk to you again, Darren, on a very hot day in sunny Dublin.
Okay, thanks, Breda. Breda, our last interview on Near FM was on World AIDS Day last year, which is held every year on the 1st of December. And I may be talking to you on Near FM in another few months about World AIDS Day 2022. I know that recently there was a big event held in the Global Health Calendar with the International AIDS Conference 2022. As this is our first interview on Near FM in a while, Breda, could you remind our listeners as to what the International AIDS Conference is, and then tell us a bit more about this year's conference?
Sure, Darren, yes. So the IAC, as it's known, the International AIDS Conference, is the leading, I would say, global scientific and community conference on HIV in the world. It was first held in the USA in Atlanta in 1985. It was held annually for a few years, but in the last decades, it's been every 2 years. And I attended my first one actually in Barcelona, I'm remembering now, 20 years ago in 2002. More recently, I joined in other locations, but in Durban in South Africa with Irish Aid and DOCA's HIV Working Group partners in 2016. And the last one I was at physically was just before the COVID pandemic, 2018 in Amsterdam. This year it's called, in number, the 24th IAC. And like you say, it was held in Montreal, Canada. 10 to 15,000 people attend the conference, and this year it was in person and virtually. And the theme for the Montreal conference this year was re-engage and follow the science. And given the past 2 years, obviously, there was a lot of focus on learning from COVID-19 and HIV responses, Darren.
Okay, we talk about that. We'll talk a bit about more in a minute. Can you tell me, Breda, if your work in Concern, and indeed that of your colleagues in Concern and the global health community in general, can you tell me if your work has returned to normal since the start of the COVID pandemic?
Not quite back to normal yet, Darren. A hybrid approach is still ongoing, with about half our staff in one day and the other half in on alternate days. So trying to maintain the physical distancing. And some people have succumbed to COVID even in the last couple of months. Thankfully not too ill, mostly with the Omicron variant, but it's telling us that, COVID is still around. And I was checking the data for Ireland last week, Health Protection Surveillance Centre, HPSC, over 8,000 cases of COVID-19 reported in Ireland last week, based on laboratory and antigen testing. And globally, nearly 7 million new cases reported, especially in the Pacific, Mediterranean and Asia regions. So it's definitely not over yet. And I guess our concerns are what will autumn bring, when people are back from holidays overseas and all these places. But we will have to continue and do as we are doing, focus on transmission prevention, interruption of infection, and trying to limit the impacts of COVID-19 on our work here in Ireland and in the countries where we work, like we do with our HIV and AIDS response work in all the countries where Concern is working.
Okay, we move on to talk more about HIV and AIDS, because that's the reason I got in touch with you, to talk about the AIDS conference and the overall picture. Breda, most people who have HIV around the world, I believe, are on antiretroviral treatment, and a lot of people who have HIV who are not on treatment are children. Can you tell me, Breda, if they or most of the people who are not on treatment at the moment will eventually get the treatment, or do we still have a lot of people dying from AIDS every year?
Well, yeah, it's true. In 2021, three quarters, 76% of adults living with HIV had access to treatment, and only 52%, or about half of children living with HIV, are currently on life-saving treatment. And this is often due to the fact that it's more difficult to make the pediatric formulations. Sometimes the syrups are difficult to transport in terms of the global supply chains and the supply chain interruptions with COVID-19, but also because of late diagnosis, and maybe mothers, parents don't know their children have HIV until they present maybe with another illness like a pneumonia, diarrhea, malaria. They're found out to be on treatment, but the extreme poor in remote rural areas and urban slum-affected populations still lack access, and the availability of life-saving child formulations are still not sufficient in terms of quantity and reach. And I think you heard, Darren, that there was a new global alliance launched to end AIDS in children by 2030, which is only, is it 8 years away now? 7 years? 2022, at the Montreal International AIDS Conference. And this alliance has been organized by UNAIDS, UNICEF and WHO, coming together to try to fix this great disparity in terms of lack of access to treatment for children living with HIV. All children have a right to life-saving medication. They want to focus on 4 areas: closing the treatment gap for pregnant and adolescent girls. I mean, to me, it's really sad that children are still being born HIV positive when we know how to prevent mother-to-child transmission. You know, we need to stop that. We need to prevent and detect new HIV infections among pregnant women and adolescent girls early so that they're on treatment, like I said, to prevent the virus passing on to their child in utero. We need to, globally, the global we, to scale up testing, treatment and care for children, infants and adolescents living with HIV. And then there's the rights-based approach in terms of addressing people's right to testing and treatment, gender equality, and all the barriers, geographic, economic, social, that hinder people's access to HIV services. As Dr. Tedros, the head of the World Health Organization, said in Montreal, no child should be born with or grow up with HIV, and no child with HIV should go without treatment. For me, better still if no child going forward is born with HIV when we know how to prevent it. We've almost 100% success rate in Ireland of preventing I'm a midwife, as you know, I trained in the Coombe Hospital, and, you know, we almost have 100% success rate in Ireland of preventing mother-to-child transmission of HIV if the mother is diagnosed on time and on appropriate treatment.
Okay, we'll come back to that in a minute. There's an article in today's Friday's Guardian newspaper about people on antiretroviral drugs in India. Can you tell our listeners a bit more about that story, Breda, and what you think of it?
Yeah, I was reading that article this morning, Darren, and I've worked in India actually with supporting people living with HIV and follow up with our local NGO partners in the Ministry of Health there. And yes, even it's a bit of a shock to me that there are 2.35 million people in India living with HIV, known to be HIV positive, but only 1.5 million are on antiretroviral medication. And this is not reaching the WHO targets of 90-90-90, where we try to reach 90% of people with HIV being diagnosed through testing, 90% on treatment, and 90% compliant with their treatment so that they're no longer infectious to other people. This 1.5 million people who are not on antiretroviral therapy but positive could be inadvertently passing the infection on to their spouses or to other people. Thankfully, I did read that the PL-HIV networks, people living with HIV networks in India, are very strong, and they're advocating and protesting on the reportedly shortage of antiretrovirals and demanding an uninterrupted monthly supply, as is their right to treatment. Maybe, I'm asking myself, COVID-19 possibly interrupted the supply chains, but my concern is also, and it wasn't raised in the article, is it that the antiretrovirals being made in India for export are being exported, and India has a very good record for making the generic antiretroviral medications through the companies there, but it might be leaving people in India short of antiretrovirals for use in country. I think it needs more investigation, Darren.
Yeah. Okay. Okay, Breda. The world has made great progress over the last 20 years in the fight against AIDS. I know that you shared with me before on Air FM that you remember the AIDS situation in Ireland in the 1980s. In the grand scheme of things, unless maybe if the world goes through a global depression, we have come a long way in the fight against AIDS in the last 40 years, and there is light at the end of the tunnel. Would you agree with that statement, Breda?
Absolutely, Darren. The glass always has to be half full. And I think you asked me earlier about the deaths from AIDS-related illnesses in 2021, because the data is always a year behind the current year. And despite the progress, there's been stalling and halting of progress in terms of interruptions with COVID, people distracted with conflict and price inflation issues. And last year, 1.5 million people were newly infected with HIV, Darren. That's probably the population of Leinster. And, over 500,000 people died from AIDS-related illnesses in 2021, 650,000. For me, this is not acceptable when HIV is technically 100% preventable. Will people living with HIV in 2022 not yet on treatment get treatment? The latest UNAIDS report is actually called In Danger, and it reports on the progress that the pandemic response to HIV is not on track to achieve Sustainable Development Goal 3. There have been increasing infections in Eastern Europe, Central Asia, the Middle East and North Africa, and even in Asia and the Pacific regions, especially among young people. International and country leaders, optimistically, I think, can get the response back on track so that treatment can be achieved. And many people you and I work with, Darren, are committed to delivering on the Sustainable Development Goals. But there needs to be more investment in HIV prevention strategies which work, treatment for children, as you say, which is lagging. And it's still sad for me now in 2022 that about 4,000 people are still newly infected with HIV every day. In Ireland, we see the data has increased in 2022 in terms of HIV diagnosis, I guess because of a backlog when there was limited testing during the pandemic in 2021. But it's going in the wrong direction. And sub-Saharan Africa, as you know, Darren, and where concern is mostly focused, remains carrying the highest burden. Almost 2/3 of all people living with HIV globally are in sub-Saharan Africa. It's the hardest hit region. Every week, about 5,000 young women, 5,000 every week, this week, last week, next week, aged 15 to 24 become infected with HIV. So in Concerns work, we're trying to mainstream and integrate a response to HIV in all our work, whether it's livelihood program, education program, health program, multi-sector integrated program, to focus on risk reduction, education, vulnerability reduction, gender actions, and to reduce the negative impacts on HIV and AIDS in, like I say, all the countries where we work, from Afghanistan to South Sudan. You asked me about the good news I did read in that big report in Danger is over the last 6 years, new HIV infections dropped by more than 45% in Lesotho, Vietnam, and Zimbabwe. And these were, highly infected countries with a big AIDS burden. Too many people have died. Also countries I've worked in like Tanzania and Uganda. So lessons need to be learned from the countries that are making some progress despite the challenges. We need to learn the lessons from these countries to scale up. And investment, like I said, in HIV strategies work. Young women and men most affected by HIV and AIDS, I think, can be supported to be leaders of the response in their own countries. Like I said, HIV stands for Human Immunodeficiency Virus. It's still, for me, hope is vital, HIV. And hopefully, Darren, we can talk again. I don't know yet. I was looking for it, the theme for World AIDS Day 2022. But we can talk again, and with our Irish Aid colleagues and DOCAS colleagues coming up to World AIDS Day on December 1st.